Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Meagan Peeters Gebler, an Appleton-based physical therapist with an extensive background in pelvic health and perinatal care. Meagan holds a doctorate in physical therapy from Marquette University, is a certified strength and conditioning specialist, and has advanced certifications in pelvic health, including pregnancy and postpartum corrective exercise specialist and certified birth healing practitioner. Meagan's passion for health and wellness led her into physical therapy, and now her work is all about helping women understand their bodies, heal with compassion, and build a positive connection between mind and body. When Meagan is not helping women regain strength and confidence, Meagan enjoys triathlon training, running, gardening, and spending time with her family, including her husband, 7-year-old son, and their 2-year-old golden retriever. In our 4 episodes together, we explore numerous hot topics related to pelvic health, as well as how Meagan helps to empower women to understand and work with their bodies for lasting positive change. Let's dive into today's conversation.
Hey guys, welcome back to the podcast. We are excited to welcome Dr. Meg from Connected Core back into the studio today.
Thank you.
Yeah. So we had 2 awesome episodes before. So we talked all about how physical therapy should be a must-have for every woman. We talked about birth to healing physically and emotional, mental. And we are going to be talking about something very interesting today, and something that a lot of you guys probably have heard about, at least, is Kegels, or Kegels, some people say. We mentioned this in the first one, but we're going to dive deep into it. So first of all, what are Kegels and how have they become the standard go-to solution for pelvic health issues? You go online, you go search for pelvic floor exercises, or I'm leaking or something, and instantly it says, do your Kegels. What is it? What does that mean? And why is it the thing that you're supposed to be doing, apparently?
Yeah, so I think a Kegel is basically the one-word descriptor for contracting your pelvic floor muscles. And I think a lot of gals get told that, whether it is them searching out answers for their leakage or their OB or their doctor that says, yeah, just do your Kegels. But it's a lot more complicated than just contracting a muscle.
Yeah, absolutely. So how do you know if it's a good exercise for you or not? Like, why would it be something that somebody would want to do?
Yeah. So there is value in contracting a muscle. The pelvic floor is skeletal muscle, and it does need to contract and relax to function well. The functions are continence, so keeping urine and gas and stool inside the body. It's also, structural, so it's going to help support the pelvic organs. It's going to also provide stability to the pelvis and the SI joint and the spine. And so there is good reason that we want those muscles to be strong and coordinated, but they just, I think, oftentimes get encouraged to just strengthen them. And I think the emphasis should be on the coordination.
Right. And you're saying like the pelvic floor is a group of muscles, right? And so a lot of women tend to think that if they're leaking, they should be doing Kegels in order to stop peeing their pants. But that's not necessarily true, because if they're over-strengthening or they're not strengthening enough, that can lead to like a loose or a tight pelvic floor. Can we talk about the difference between those types of pelvic floor?
Yeah. Yep. Yeah. So like, again, every other muscle in the body, I think, the pelvic floor can be, I like to use the words underactive or overactive.
Yes.
And typically I think that state of activity of the pelvic floor is going to give us insight into the state of the whole system. So, kind of going back to different postures that we're in, different activities that we're doing, different stress that we're holding onto, they all can contribute to what that pelvic floor feels its job needs to be. So if we've leaked once, our pelvic floor, we may be holding it more tense consciously or subconsciously because we don't want to leak again. Or, may have went on a bike ride and we had some tailbone pain or pelvic pain after, and that muscle may have stayed kind of guarded and overactive in response to that pain. So I think it's, kind of getting interested and curious in, okay, well, why is that muscle either over or underactive? And then what do we need to do to kind of normalize where it's resting?
What do you most often see, over or underactive?
Over.
Yeah.
Okay, so why would people have an overactive pelvis? I mean, you just mentioned, like if you ride a bike and you're trying to protect, like as a protective factor.
Yeah.
Does pregnancy impact the state of your pelvic floor? Are there other environmental or lifestyle factors that are causing people to have tight pelvic floors?
Yeah. So there's so many different variables. I think that some of the more common ones that I see are leakage and fear of leakage. And
so you're saying they're like clenching their pelvic floor all the time because they're afraid they're going to leak.
Yes.
Right.
Okay.
Yep.
So if you're doing Kegels, that's basically clenching.
Correct.
Yeah. Ooh, there it is.
And you might feel relatively weak, but if your pelvic floor is contracted, you don't have anywhere to contract.
You don't
to.
have any more strength left.
You're on the ceiling. You can't lift it up any higher. Other factors are, like we mentioned, like the hobbies. So bike riding, horseback riding, snowmobile riding, motorcycle riding. And then other things would be stress. So pelvic floor is a very common area for women to hold on to stress and tension. It's the bottom of our body. It's our root chakra. It's where we hold on to safety. And it's, the other way I like to describe it is our enteric nervous system. So our gut, right? So when we get butterflies or we have a gut feeling, all of those emotions we kind of feel down that midline of our body. The top of that gut tube is our jaw, and the bottom is the pelvic floor. And so if we're feeling any stress or distress in our emotional state of being, a lot of times we'll see the pelvic floor subconsciously activate to create some stability and safety in the bottom. And oftentimes those gals will also share that they're grinding their teeth or they're clenching their jaw or
Tight
experiencing
shoulders.
headaches. Yeah. And kind of those two opposite ends of that gut tube, which is basically the outside world, is how we will see that stress piece show up.
Wow, that's really interesting. So how would a woman actually know if she has a overactive or underactive pelvic floor? Does she see someone like you? Is there something we could like maybe do right now on the podcast that could kind of help people try and see if they can feel anything?
Yeah. So, I mean, the quick answer is, have someone assess and give you that feedback. The second quick answer is if you're experiencing any symptoms, chances are it's the strategy is not working, right? So having someone assess that. But, something quick we can do is just kind of a sensory awareness experiment. So if we're sitting on a firm surface and we take a nice inhale, we should be able to sense that breath and that pressure of the breath. Our diaphragm will descend, which will create a wave of pressure and expansion through the abdomen. And then the soft tissue between the sits bones should also descend. So we should feel a little bit more fullness during that inhale between our sits bones. We may even be able to sense our tail wagging out and kind of an opening sensation at the bottom of the pelvis. And then as we exhale, there's just a natural recoil that happens where as that diaphragm lifts back up and the pressure changes, that creates a nice little vacuum that lifts our guts and our pelvic floor up and in. So you can almost sense the sits bones moving towards each other, the tailbone wagging in. You might also feel like the perineal tissue, that area between the vaginal opening and the anus, elevate during that exhale. And so not uncommon for gals to not be able to feel any of that. Part of that, again, is just if you've never paid attention to that area, the brain is not as tuned in. And part of it is also a protective mechanism, right? If we've experienced leakage or pain or traumatic birth or anything of that nature, we may just protectively not be aware.
About that. I loved how you described that. Like as you're talking, I'm like, okay, I'm going to do this with you as you're speaking. And I mean, Britt and I are also pretty aware of, we've been doing this for a while too, but I'm like, I love how you describe that, because if somebody kind of thinks about how you were saying that, it can be really helpful.
Well, and I would even encourage them to hit pause.
Yeah.
And do a few breath cycles to just try and feel it. Because like you said, if they've never thought about it before, it's going to take some time to maybe get your brain to actually connect to the muscles you're trying to feel.
Mm-hmm. And if you really can't feel it, that's when you should probably make an appointment with Meg or with a pelvic PT that can really help kind of talk you through it a little bit.
So you said in order to truly know, to have an eval done is probably what the next step would be. What does that look like? Is that internal? Is that external? What should someone expect from a physical therapist in this realm?
Yeah. So you can get some information externally, right? So if you're seeing a pelvic PT, oftentimes they may start that assessment externally, where you would be lying on your back, typically with your hips or knees bent. You can also do it in standing, but their hand would be placed just kind of inside the sits bones by your tailbone. And the kind of the skilled fingertips of a PT are going to be able to sense pressure and tension changes in those tissues. Right. And so that can be kind of a good launching point. But then from there, the gold standard really is an internal assessment. And, it's typically gals will say, oh my gosh, that was not nearly what I thought it was going to be. It is very much about being respectful to the tissues and just getting information and insight and giving direct feedback. And I will say too, I've been fooled before where something might feel like it's coordinated externally, and then with an internal assessment, we may find the right side of the pelvic floor is showing up great and coordinated, and the left side is in lockdown and there's no motion whatsoever. And, there's no way to know that unless you're able to assess it.
So is this like what someone would expect in an OB office?
Not quite. No. So this is, there is no speculum. There are no stirrups. This is typically just a single gloved, lubricated index finger that is inserted intravaginally to then assess the muscle layers from superficial to deep, as well as, depending upon your therapist, they may also be able to assess where's the urethra, the bladder, the cervix, and other structures in the pelvis that can impact how your pelvic floor will show up.
I found it really interesting how you said that like one side of the pelvic floor could have some tightness while the other side is not having that. What would be a cause of an imbalance like that?
Yeah, so it can be more structural, biomechanical. So if someone has an ankle that's not moving well or a foot that's not moving well on one side, that may impact how they're loading up that entire side of their body. And the hip is right in the neighborhood, and the muscles that rotate the hip are actually the side walls of that vaginal vault. So someone with hip injury, knee injury, lower extremity injury, oftentimes we'll see an asymmetry in how their pelvic floor is coordinating, and then also just kind of muscle bulk and how the strength then translates from that.
Okay. Does the type of delivery, so vaginal versus cesarean, does that impact the state of a woman's pelvic floor?
Yeah. So the quick answer is yes. That as well as the position of delivery, right? So depending upon whether baby is born via the abdomen or the pelvis, that's going to change what the bones of the pelvis do during the birth process. When the bones end up in different positions based upon the position of the vaginal delivery, that then also can change the resting state of the pelvic floor. So, for example, if someone delivered in left side lying, that left side of their pelvic bones are going to be anchored on the surface that they're on, and the right side may move more. So we may see their sits bone on that right side splay out to the side, creating an asymmetry. And the pelvic floor muscles that connect to those bones then are going to be under a different length and tension on the right versus the left side.
I think a lot of people think about when you have a baby vaginally, that the tissues stretch and therefore their pelvic floor is loose. And so that's why they need Kegels, right? So, kind of getting back to that topic as well. But with a cesarean, they may not have the stretching of the vaginal canal like a woman who delivered that way. So does the length of pregnancy, just like pregnancy in general, does that affect a woman and how she may have a tight or a loose pelvic floor?
Yeah. Yep. Yeah. So regardless of delivery, just the postural changes and the positional changes and the stress of carrying a baby in your pelvis, those pelvic floor muscles are working structurally to both, let mom be mobile, but then also support baby. And then even within that, if a woman is experiencing round ligament pain, or depending upon how she's carrying, that also is going to change where the uterus and cervix is relative to the other structures. And where that lands, that connects to the bones and the muscles, and it's all going to have an impact in what the pelvic floor function looks like postpartum.
Okay, and then is there any merit to the whole, I've had 5 babies, so I have a very stretched out vaginal canal. Is there any merit to that? And is there the more babies you have, the more issues you may have, the more leaking you may have? What are your thoughts on kind of that myth that goes around?
Yeah, I think the myth is presenting itself partially because I don't know that women have taken action between the births. And so I don't think we even have data to know and compare a woman who's had 5 pregnancies and 5 vaginal deliveries and went through pelvic floor PT during every pregnancy and postpartum. Her pelvis is going to be very different than a woman who's had 5 babies and has not done a thing until her 5th baby goes to kindergarten.
That would be actually really interesting, because I think in countries in Europe, they actually do offer pelvic PT. And I'm sure that you could probably do like a case study of some kind comparison. That would be really interesting to see.
Where you mean they actually the PT is part of their
PT
care plan?
Is part
it's
of their
expected?
Care. Yes, it's part of their insurance. It's everything. It's part of everything. So that's really interesting. I have a question. So should you ever leak? Like if you're coughing a lot from a cold, I had a cold, I don't know, last year sometime, and I just couldn't stop coughing and I would end up leaking. Is that a huge concern? Should I be I need to see pelvic PT? My pelvic is falling out. Oh my gosh. What's your opinion on that?
Yeah. So, I do believe that we shouldn't ever leak, not even a drop, not ever. But I also think that the magnitude of the stress response that leads to the leak gives insight. Mm-hmm. So someone's pelvic floor that leaks with one sneeze is going to be very different than someone who's, had the stomach flu and has been vomiting for 10 days. Those are very different mechanical stressors, and, it's not an emergency and you don't have to feel like you're broken, but there is insight into the load was greater than the capacity for the function of the environment.
Yeah, I think about that with another muscle, so if you're if you're doing a bicep curl with an apple, periodically once an hour, that might be a sneeze here and there where, I can handle it. My muscle is strong enough. But then if you do a very heavily loaded workout, that muscle is going to hit its max, right? So that's kind of how you're saying.
Exactly.
Okay. Okay. So before we finish up this episode, I want to circle back to the overtight, what was the other one?
The underactive,
overactive. I'm trying to use your terminology here. I want to get back to that and talk about, if Kegels aren't always the solution, what are the solutions? So if you can just walk us through really quick, if a woman has an overactive pelvic floor, what is kind of your approach for treatment? And if a woman has an underactive pelvic floor, what is your approach for treatment?
Mm-hmm. So that's where the breath comes in.
There it is again.
Right?
Yep.
Yeah. So, oftentimes it's what I'll tell my clients is, the quality of your exhale depends upon the quality of your inhale that precedes it, and vice versa. And I think that most often gals will have come across the idea of Kegling with an exhale, right? And that's a good start. But if they're never letting go and allowing the breath of their inhale to find their pelvic space, they're going to run out of room, right? They're not going to be able to contract again. So, if someone's overactive, I will often encourage them to pay more attention to the inhale, to allow that expansion and that eccentric lengthening and that opening to happen more than the exhale. If someone is having more underactive, I may give them the focus of the exhale and that lifting aspect.
So for someone who has an underactive pelvic floor, so one that's not firing well or contracting well, Kegels may be a good exercise for them while focusing on breath. And
maybe.
Maybe.
Yeah. And part of a more broad-based approach where, because we want to know, why are they weak?
Right.
Are they inhibited from pain? Are they a part of just a system where there's something going on upstream in the lumbar spine? What's driving their inability to show up?
Okay. And then for an overactive pelvic floor, so the one that is already hitting the ceiling, I like that analogy. It's easy to see. Kegels would almost never be the answer for those people, right? Because they're already, their focus is more on learning the relaxation piece. Is that correct?
Right.
And I just find it so interesting how you said a big percentage of women have an overactive pelvic floor. So actually Kegels could be doing completely the wrong thing of what they're looking for. Right. Okay. Is there anything else that you commonly get asked questions on related to pelvic floor tightness, looseness, Kegels specifically? Anything else that you want to share on this topic that you feel like is something that women are asking you often?
I think probably something good to share is that if a gal is getting frustrated and doesn't feel like they can make progress or sense the motion, again, there's a reason why. And, I will oftentimes see gals where the position of their pelvic bones is making it as difficult as possible for them to access their pelvic floor. And so finding someone that can help get your body into a position that allows your muscles to do their job. Because really, I believe that the body wants to do well. And there's a bigger reason as to why they're not showing up. So just telling gals that if they're feeling frustrated or not making progress, that finding someone to help them figure out why.
Perfect. And how can somebody contact you if they're listening to this and they just have more questions that they want to follow up with?
Yeah, so I do answer emails. You can email me at meagan@connectedcorept.com and guide people that way. Oftentimes that will lead to an in-clinic appointment where we can talk more in person and see people move and breathe and get an idea of how their system is functioning.
And you are just a one-woman show right now, right? Like when you say come in the clinic, it's not like a big medical feeling clinic. Like you have a cozy little space and you're just a one-woman show that is amazing and doing so much good in our area. So thank you for what you're doing.
All right. Well, thanks, Meg. This was such an insightful episode. I think that a lot of women are really going to learn a lot about what we talked about. And I hope that they reach out to you because you have a lot of answers and it was great to talk with you. So stick around, you guys. We have another episode coming up. We're going to be talking about lifestyle and all sorts of things that affect not just your pelvic floor, but everything else. So stay tuned for that.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.